Hello and good morning, everyone. We're going to kind of take a minute or two to let people find the link and start to trickle into this breakout session. So if you need to get any last minute cups of water, the restroom, fill up your coffee, now is definitely the time to do that. And thank you so much for joining us. We're very excited to present today. All right, looks like we don't have anybody else kind of jumping in. So we will start to the presentation. So welcome to the transportation breakout for day one. We are really working to unite these transportation programs. So we wanted to share with you some rural transportation leaders and their successes and barriers that they've been experienced through this work. So today we're going to have presenters Kent Ellsworth and Christopher Vertrees, and we will begin with the Verde Valley Caregivers Coalition about it and services provided, as well as the Southeastern Arizona Government Organization, SEAGO. And we will learn all about that, barriers for rural transportation, and all these different types of solutions and management and planning that's been done. And then we'll have questions at the very end. My name is Amy Backus. I will also be your room moderator. So if you have any questions, feel free to privately message me. If you don't want to share it with the entire group, but you're welcome to share it with the entire group. And I'll be kind of answering questions, that sort of thing. Just one last thing, if you go up to the corner of your screen, there's a view. You can push speaker view. Sometimes I like that a little bit better when I'm watching a presentation like that, so you can really see who's talking and not have a bunch of little squares. So I will begin with Kent Ellsworth. Welcome, and I will give it over to you. Thank you, Kent.
Thank you, Amy, and special thanks to the Arizona Coalition of Military Families for inviting me to present today. And next slide. So we are Verde Valley Caregivers Coalition, and we've been doing what we do now for 30 years. See that little 30-year logo up there? And it's been a fascinating progress of developing this program in a rural area of Arizona. Next slide. Our vision is to create an age-friendly community for everyone. And next slide. Our focus really is to leave no senior isolated or alone. And I can tell you that so many of the people we're serving love rural America. They came here because they like the peace, they like the quiet, they don't like all of the noise of a metropolitan area and all the, sometimes there's a lot of difficulties in living in big cities. I've lived in both. I've lived in the center of Los Angeles for 9 years and the San Francisco Bay Area for 12 years. I've lived in rural areas, rural Western North Dakota, Western Montana, places like that. And I really love rural America. But so often, many of our seniors end up being fairly isolated. They want to live here for the rest of their life. They don't want to move to a different community. This is their community. And we're serving about 8 different community areas in the Verde Valley. But we don't want our folks to be isolated. So the community needs to come together and make this happen. The community needs to be a part of their family. So next slide. So we're helping about 1,900 older adults and younger adults too, who are living with disabilities. And about 1,500 of the people we're helping each year live alone. And so we are family. and most can no longer drive due to disability, whether it's temporary or permanent, due to illness, chronic health conditions, and that type of thing, oftentimes advanced age. Just so you know, we're serving about 12 people who are over 100 years of age. Some of them are World War II veterans, veterans from the Korean War, and so forth. The average age is 87, and 50% of the people we live, unfortunately, live at approximately about 150% of the poverty level, which is about $1,700 a month or less. And 90% qualify for low-income services such as low-income housing. We're serving 517 veterans right now. Next slide. So here in the Verde Valley, it's really an interesting place, isn't it? It's about 50% of our population is 55 and older. And 1/3, well, actually about 34% of the Verde Valley population is 65 and older. And that the average number of needs increasing, the number of people who need our help increases all the time. For example, we've brought in new clients, 600 new clients in 2021. And that's averaging 12 to 15 new, we call them our neighbors, because they really are. And each week we bring in at least 12 to 15, and we're helping more and more veterans all the time. Next slide. And care coordination is one of the services we provide. That's a very important thing. I mean, how do we get people connected to that whole array of services that they need? And it takes, for us, in working with the population we work with, it takes more than just giving a person a phone number or a name of another organization. We help them get connected. We do those application forms, whether it's for the SNAP food stamps program or a food bank or anything out there, even their access, their Arizona Access application, we help with that too. Applications for low-income housing, you name it. And home safety checks, we gather important information to make sure they're getting connected to the healthcare services they need. Hello?
Kent?
Yes. There. We just had a problem with our internet, I suppose. Sorry.
No, you're fine. You can continue.
Okay. And when we look at all of those kinds of things that we need to do up front, it takes a good, honest assessment of the needs and making that big to-do list and helping each individual we're serving go through that to-do list. And next slide. And here are the services we provide. And of course, just back to that little glitch with our internet, we live in a rural area, so unfortunately, kind of goes in and out. We give lots of folks rides to the VA health facilities, the hospitals and medical clinics all throughout the state. And we do medication pickup, grocery shopping, and pick up food boxes from food banks. We take people to physical therapy, dialysis, and next slide. And all the things that we provide without charge to all of our clients. Yes, we get people from the rural areas down to the VA hospital in Phoenix. We provide that free of charge. We have 3 wheelchair accessible vans. We'll be getting 2 more fairly soon. So it's such an important thing for us to be here to make sure people can get connected to healthcare and other services. We provide pet assistance too. We help people get their pets, it's such an important thing, get their pets to veterinarian care. We pay for that. And we help them purchase the pet food as well. It's such an important thing. They can't, sometimes that pet is the only friend they've got in their home. So all of those parts of it are extremely important. And paying, actually, in some cases, we help people purchase food. We get into a situation where the food bank box may not be enough. They may not have enough money. It could be at the end of the month and things are really tight. So we have a crisis fund of about $5,000 to $6,000 each year that we use to be able to purchase these kinds of things for the people we're serving. And that's really an important thing, to be able to say yes, to respond to that immediate need. And so not only do we give rides to healthcare, but we give rides to all sorts of other destinations, any destination that individual really needs to go to. So next slide. And handy person help. Sometimes changing that light bulb is not something a 95-year-old should do, get up on that ladder. So we go do that. And we provide some respite care when a spouse needs to get away from the home. And we do that free of charge as well. And that really seems to make a great difference, knowing that we're supporting the family's care of that individual who needs his help. Next slide. And tech help. So this is a new deal. We have so many people who have a technology device, and what happens is they get stuck with it. So we have about 70% of the people we're serving have some sort of IT device. They can get a smartphone or a tablet, and usually they get it because a loved one living in another state mailed it to them. But getting it set up is another issue. So we have folks who will go out and set up that device free of charge, get that voicemail box set up and all of that. In addition to this tech help, we also provide assistance with virtual care. So we send a staff person or a volunteer out to the home with a laptop and a hotspot, and we can get them connected for that virtual care appointment, even when they live out where there's no cell phone towers. That hotspot is actually satellite connected, and we can make sure they can get that care wherever they live. Next slide. Yes, and emergency alert devices. So what if a person does fall? They live alone, so many of our people do, and how can they get to that phone? So we provide this without charge as a loan, several different types of devices. The one that seems to work the best is connected to cell phone towers. If a person falls, it detects the fall and calls 911 right away. Next slide. And social visits and outings, just being together. And this person you see on that picture is Boots. He's a veteran of World War II. He was in the Asian arena there. And he's 103 years old and still going strong. So we have a whole team of volunteers who helps him, doesn't have any family, and they really take great care of him, that whole team of volunteers. They go out to the home, they call him on the phone, we had a big party for him for his birthday just a few weeks back. And we take him to movies. We have several carloads of the people we're helping, our clients, with volunteers driving, and we take them out to the movies at least once a month, and to the local libraries and community events as well. And staying together is so important. Next slide. And public outreach. So it's so important for us to make sure we're out there and people know about us. We will not turn away anybody that's qualified for services who really needs our help, whether it's temporary or long-term. And I think that's such a vital thing, to never say no to somebody in need. And next slide. And that's it. Thank you, everybody. It's been a privilege to be able to present today.
Thank you, Kent, so much. Wonderful presentation. You guys do incredible work. As we all just have seen. So thank you so much for all that incredible work that you do. And we will hand it off to Chris. If you have any questions for Kent, we'll ask everything at the end. So Chris, I will hand it off to you.
Hey, thank you, Amy, and thank you for having SEAGO at this event today. We greatly appreciate it. Next slide, Amy. Okay, just to start with, Kent just gave you the perspective from a provider. I'm going to give you a little bit more of a regional perspective and how we go about finding solutions to transportation and identify barriers. SEAGO is a planning agent. It coordinates a variety of functions. One of those is transportation planning. We're one of 6 COGs in the state. That's councils of governments. Our area serves Cochise, Graham, Greenlee, and Santa Cruz counties. We have almost 14,000 square miles, and our region is bigger than 9 states. So it's almost all rural with the exception of our Sierra Vista area. So we have a lot of rural ground to cover. Next slide, please. Some of the transportation barriers that we see in our rural area down here in the southeast corner of Arizona is limited transportation providers. We have about 8 central population areas. Most of our transportation providers are there. Most of our area is out of population centers, and so we have very limited providers that can serve large areas of the region. Limited access to food and medical services. For example, we have 18 member agencies. Only 5 of them have dialysis centers in their communities. That means the majority of our population has to be transported for dialysis. Very few oncologists, very few cardiac doctors, very few orthopedic doctors. Almost a large portion of our population needs to be transported to Tucson or population centers such as Sierra Vista. Population density is a very common problem in the rural areas. One is you have a low income tax base, you have limited funding opportunities, you have smaller transportation programs, you have fewer volunteers, and lower investment in transportation altogether. But the big thing is you can't compare rural transportation needs to metro transportation needs. It's like comparing oranges to tomatoes. The difference is so unique. And one of the things is your efficiency data is really obscured in the regional areas. Your cost per trip, you have high demand in terms of your population, but in terms of overall population, you're not competitive with the metro area. So a 3,000 rides for one program here is when you include the mileage they have to travel, is intense as compared to a metro area where there's much more options. So your data is obscured, and sometimes when it's choosing between funding a rural project or an urban project, most of the time because of those numbers, the money flows to the urban areas. Demand for inner city, like I said, you can't move around our communities easily. You have to receive services. You have to be willing to travel to Tucson. We have to find ways to help people get to Tucson. Again, distance is the big factor there. High cost of private transportation, for example, if somebody going to the VA from Douglas in our region could cost a person through a private provider upwards of over $200. Limited access to funding, like I said, the competition is fierce when it comes to federal money and even local money. So that is really difficult. Duplication of services. You find that there's a lot of programs out there that aren't involved with the mobility management program in these COGs. And so we're providing services that are duplicated instead of trying to take advantage of what each and everyone is doing. Transit needs for the elderly, disabled, low income, and veterans is magnified. It is really tough to find solutions for all those needs. So it is a significant barrier. Qualified staff, finding drivers, finding administrative staff that know how to run a transit program is difficult. And the biggest, one of the biggest things is when a project is funded, sustainability. You got to have a sustainability plan. And for example, we've got a project in Tucson that received a grant from a private entity, and it will fund the program for 2 years, but there's no guarantees past that. So sustainability is definitely a barrier. Next slide. One of the biggest things that help us establish how we help, where we prioritize our regional resources and stuff is coordinated mobility planning. This includes transit studies. We try to do a couple a year. We try to leverage federal funding to do these studies, transit surveys. We use this data to identify where our needs and our gaps are, and to use those surveys to seek additional funds and to seek planning funds so that we can expand on certain areas. Data collection and analysis, again, that's usually drawn from the surveys, but historical ridership data and data from the Census Bureau, we take care of that. We develop specialized work groups, community public participation meetings. We found that specialized work groups help move transportation projects much farther along than just trying to go it alone. So we bring in as many people as we can into the planning process. We host coordination meetings, and that includes not just transportation providers, but human service providers and medical providers and specialized community services. We participate in the public transit technical advisory committees of all our 5311 programs. For those of you that aren't aware of what federal transit in rural Arizona, you see two basic types of funding from the federal government. One is 5310, that's for your elderly and disabled transportation, and 5311 for your rural general public transportation. And those are usually in your smaller towns and cities. And then we develop the regional coordination plan, which really sets the entire mobility process for the region. And those of you that don't understand or are not aware of the federal funding process, you have to be in a regional transit coordination plan to be eligible for federal funding. So we try to include as many agencies and projects in that planning process. Next slide. And our biggest initiative in terms of transit is our mobility management program. Right here, I've listed a few goals of our mobility management program. We cover all 4 counties. We seek transit solutions for all 4 counties. And these are the goals of our mobility management program. That's a greater public access to transportation, provide support to existing local mobility managers and transportation providers. We do a lot of technical assistance, identify ways to fill gaps. Again, that's part of the planning process, the coordination process. We identify the gaps and we identify strategies to fill them. Identify ways to ease barriers. Again, that's part of our planning process. We work to identify those barriers, and then we use our work groups to generate solutions. Our work groups, we've had specialized work groups in Wilcox, in Safford, in Nogales, and they all led to expanded programs and expanded services. So we use our work groups to help us find ways to ease those barriers. We act as a conduit between transportation providers and transportation funders, and act as an advocate for the development of federal, state, and local transit policies. And seek out opportunities and goals to increase transit in our areas. Next slide. And if you take anything away from this presentation, one thing is if you're ever seeking funding or just the capacity to grow your program, leverage is the key. And I'm going to start with the wheel. Existing services, we'll end on funding, but existing services, one of the examples of that is, like I said, 5310 programs are for elderly and disabled clients. The problem you have is they don't have a lot of funding, very limited funding. If we partner those, and we do this with our 5311 agency, especially when it comes to dispatch opportunities, 5310 programs can't afford a dispatcher or a scheduler in most cases. So we partner with our 5311 dispatch systems to help leverage services. That means getting more people on vehicles than a program that didn't use the dispatch services. Partnerships, we really focus on partnerships, and we don't look at just transportation providers as partnerships. You'll find that there's so many programs out there have small transportation budgets, but don't have the means to expend them. That's why we try to draw in as many providers into our planning process as possible and to leverage those volunteers. We look at ways to increase the number of volunteers. We find ways to help fund our volunteer programs through aging dollars, which allows those that are in the FTA Section 5310 program to request more funding by giving them additional dollars through the aging program. It has a small transportation funding block that's available to people. Knowledge, we kind of get hyper-focused on just transit, and we take advantage of our transit, but we have to draw in the knowledge of medical providers, the knowledge of veterans groups, the knowledge of elderly groups and food banks and stuff like that to help us find solutions for barriers. Public participation. One of the biggest things with public participation is you get points of view that you won't get in a closed process. Also, you find once you include the public, they're willing to be involved in part of the solutions. A lot of our public participation has led to volunteers to help us get the word out of new programs into our communities. They often, people of the public will volunteer to take the lead and getting information out, and we take advantage of that. Human resources, we've talked about them, and not just using transit providers, but using all of the human resources that are out there and available to us in terms of medical resources and in terms of specialized groups. One of the biggest things you can't ignore, I've always said that transit is a passion business. If you don't have passionate people for helping and for making sure that people have transportation, programs are going to die, they're going to wither, they're not going to move forward. And one of the biggest things we try to do is take advantage of those people in the community that are passionate about finding solutions. And then funding, this is where, like I said, there's many programs out there that have other centric services, but have a small transportation budget. We leverage those. We leverage letters of support from groups, commitment to partnerships. We do all those things to increase our access to funding. Like I said, if you take anything from this is developing leverage strategies if you're going to pursue funding to improve, expand, or create a new program. Next slide. And some of our solutions here in our corner of the state is increased coordination strategies. And what I mean by that is we try to link programs with similar missions, try to to identify the overlapping gaps and try to limit those and try to find solutions between providers that are beneficial to both programs. Increase ride sharing strategies. Like I said, one is using 5311 dispatch centers for our non-public transit programs. By doing that, you can put more people in seats, reduce the cost there. One of the things we do is, like I said, only 5 of our communities have dialysis centers. So we've got 14 other communities that got to be transported to these areas. Instead of one program, let's say in Safford, that has to get to Sierra Vista or Tucson for dialysis, we find ways to match these 2 programs up, that one goes 50% of the way, drops it off to the next one goes the other 50%, or something close to that. We have a regional coordinating council. We have over 50 members, which only half are transit providers. The rest come from other areas of the community, including fire departments, which have especially in rural Arizona, there's an issue with, there is no transportation providers. So somebody will call an ambulance service out of a smaller community to get into the larger into communities that have more opportunities. So we see our small ambulance and fire services being overwhelmed by ridership, by people requesting emergency services that don't actually need them, to get transported into a community. And then the next thing they know is they're walking out of the hospital and going about the rest of their business. We have quarterly coordination meetings and localized networking. By putting groups together, especially groups that are not just all transit, the networking opportunities are extremely important to us. We've developed resource sharing MOUs. 28 agencies have signed an agreement to share resources in our region, something we're very proud of. In case of emergencies, driver shortages, they help each other out. We're constantly securing FTA and ADOT planning funds to identify solutions. We've done studies to reduce costs for our providers, feasibility studies to start new services, transit needs studies to identify the demand for services. So we do a lot of pre-planning so we can find opportunities. We use our leverage principles to find funding outside of the ADOT FTA program. Just in the last few years, we've secured over 800,000. That does not stay into SEAGO. It just a small portion covers our internal costs, but that funding is distributed to our providers. We secured a direct FTA funding outside of ADOT to do a medical and food access pilot program. Develop connecting services between FTA Section 5311 programs. We found a way, we did a feasibility study and found a way. We have 4 communities within 30 miles of each other that had 5311 programs. We found a way to have a linking service that links all those 5311 programs together, which cleared a lot of gaps for us, allows people to travel from Douglas to Sierra Vista and then on to Benson to the national bus network through those type of activities. The next one is improve access to the national bus network. Developed several 5311 community transportation programs. Like I talked about earlier, we expanded our volunteer programs. We have similar volunteer programs that Kent talked about, that drivers use their own vehicles and transport one-on-one. We have been lucky in finding vehicles, vans for these programs so that can use one driver, but transport 4 or 5 people at a time. So we really do focus on finding vehicles for these volunteer programs. We developed a coordinated mobility training program that improves operation safety, and it started here in Cochise County in Southern Arizona, and now we offer that program throughout the state. The big thing there is, like I said, qualified staff. transit administrators being able to identify your true transit costs and stuff like that. We provide that training to programs to improve their administrative capability, also their passenger safety and staff safety through our PASS training program that is delivered throughout the state. And then we leverage Older Americans Act funding to grow existing transportation funding. We're kind of unique here. We fund multiple 5310 programs because operating in the 5310 program from the FTA is a 50-50 match. So you can only request as many dollars as you can match. So we find ways to get Older Americans Act funding into these volunteer programs, into these 5311 programs. So instead of requesting 50,000, they can request 100,000 for the program. So that has been a big focus for us. Next slide, please. And if you have any questions on, or if you need any more information about SEAGO or what we do, a big resource is our SEAGO mobility.org website. It's a standalone transit mobility site for Southern Arizona. You'll find a lot of information on our studies if you're looking for templates or ideas for a future study, because most federal funding has to be tied to identification in some type of planning, regional planning effort if you're really going to pursue federal dollars, which is and also like in our coordination planning. You also find our coordination plan there. You'll find links to SEAGO.org. You'll find links to our transit program and our mobility management program there. So again, thank you all. And if you have any questions, I'll be glad to answer them once Amy opens up for questions.
Wonderful, Chris. Thank you so much. It's always so much amazing information to be taking in during these breakouts and just these presentations. So I appreciate your time and for you joining us and doing that presentation for us. If anyone has questions for Ken or Chris, now is definitely the time. Either put it in the chat box or we can, if you can raise your hand, we will definitely want to hear those. All right, we'll take a few more minutes to see if anybody's, oh, we got some very useful information. Thanks, Zach. The session does officially end at 10:10, but we can kind of trickle back to the main session if people don't have any questions for Ken and Chris. I'm going to put the event center link back into the chat for everybody. To be able to go back to where that general session is, taking a break, and then we're going to be jumping into the second half. Oh, we got some questions for you from Mike. How are organizations able to get started? Grassroots, government?
Would you? I could start. Our organization got started basically grassroots with a group of 5 churches who decided to collaborate because they could see this problem and they wanted to come up with a solution. They rolled up their sleeves, got started, and created Verde Valley Caregivers Coalition. And then building the sustainability, as Chris mentioned, has been a year-to-year process. You have to build that brick by brick across time. And that's what we've been doing. And so that works. But getting started means that the communities have to be prepared to jump in. It's not somebody else's task or chore. That chore belongs to all of us. So that's what we are.
Yeah, and if I could add to Kent, all the COGS in the state, almost all the state is covered by a council of government, and it has a mobility management program. If you are a new transit provider, or if you are interested in expanded transit, my first recommendation to you is to get involved in these mobility management groups. You're not only going to find information, but you're going to find access to resources, into idea sharing, into a lot of opportunities that, most of our, I would say 25% of the programs we've developed in the last 5 years were grassroots, started out on their own, found their way into our mobility management group. We helped them prepare ADOT 5310 or 5311 applications, or we started work task force groups or task force to find solutions. So I would really point you in that direction. Find the mobility management group in your area and join their meetings.
Wonderful. Great question, Mike. And then how important was including veterans to your organization's ability to fundraise and gain support?
Well, it's been very, very important. That's basically how we got started. And so many of our staff, our paid staff and our volunteers are veterans, and we serve lots of veterans, but it's who in the community is going to roll up their sleeves and come and help out, use their own car to go out and pick people up as a volunteer transportation service. Who's going to want to work to run that van every day that we have? And so often we see it's veterans in our area who step up to the plate and say, count me in, I'm going to help. So that's absolutely essential.
And I would agree with Kent. Our 3 or 4 primary focus areas that we look to serve are the elderly, the disabled, the low income, and our veteran groups. Really the solution for a lot of our veterans is veteran volunteers. They support so much of our veteran transportation to the VA from our regions. So yeah, without their support, it is really tough to find solutions.
I just want to add too, as someone that works with the coalition and kind of works in some of this realm, or at least works with the organizations that do, a lot of the population in the rural area tend to be veterans as well. And so both the people that are willing to volunteer and do that community work, as well as many members of the communities, are veterans. So it just makes sense to have those veterans focused on and help with that fundraising and gaining support within the community. So great questions, Mike. Really appreciate those. Anyone have any inspirational questions when they were listening to Mike's questions being answered? All right. I just kind of want to add too, since we have a few more minutes, Kent and Chris, thank you so much. A lot of times in Arizona, the rural areas are just, we have a lot of rural areas, and trying to get people to those services can be really, there's a lot of barriers that come into play. So we have another question about tips on recruiting volunteers and the best way to do that. We know across the board organizations have had a hard time. Do you have any kind of tips for anybody?
Yes, well, that's always a big chore and something we do have to focus on. So basically our process is to do presentations, usually about 20 or so a year in service clubs at churches. We go to exercise groups, even yoga groups, and hand out materials. I mean, the service clubs are really good. We find a lot of great volunteers there, and at the churches and at the libraries. So we hold information sessions at libraries, and we publish our materials through all the different municipal governments in our area and get their help as well. So it's just really a widespread, broad marketing plan. I've actually gone to grocery stores in the past and set up a table and let people know here's a chance to make an even bigger difference in your life. and we've gotten volunteers that way too. So it's all of the above process. Thanks.
And if I can just add to Kent, outreach is the key. Between me and my mobility manager and assistant mobility manager, we speak to probably 30 different groups a year, trying to recruit them into our transit programs as volunteers, including city council meetings and executive board meetings for a lot of our private agencies, so and public nonprofit agencies. So yeah, outreach.
Wonderful, all just wonderful like questions, and we really appreciate everybody kind of coming in. And so we are going to take a break. We're going to have a break from 9:15 to 9:25. Oh, sorry, I was reading the wrong one. I apologize. Our second break is 10:10 to 10:20. And then we'll kind of come back and do our roads to solutions. We encourage you to please join us for that second breakout session for the same topic, just so we can kind of keep that momentum going. And now that you've seen and heard from some of those key organizations that are doing the work out there, there'll be a great opportunity for folks to really deep dive in ways to solve some of these barriers and work on ways to go forward and be as productive and effective as possible. So that link in the chat I put in so you can see the agenda, anything that you need to figure out times, that sort of thing. But please join us back here at 10:20, and then from 10:20 we'll have another break at 11:30. Presenters, feel free to turn off your cameras and your mics, and we will take a few